All right, everyone, it's 2 o'clock, so let's go ahead and get our briefing started for Tuesday, June 8th. I'm Kimberly Kane, filling in for Catherine Foley. While Catherine is on vacation, she'll return the week of June 21st. So on our panel today, we have Milwaukee County Executive David Crowley. We have Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management. Kirsten Johnson, Commissioner of the Milwaukee Health Department, joins us as well, along with Mara Lord, Senior Vice President, University Engagement and Strategic Planning at the Medical College of Wisconsin and Chair of the Vaccine Integrated Communications, Outreach and Mobilization, or VICOM. Let's go ahead and get started with County Executive David Crowley.
Well, thank you so much, Kimberly, and good afternoon to everyone who is joining us. So I'm happy to report that we have been seeing some promising trends with COVID-19 in Milwaukee County, and they've been continuing. So the average daily number of new cases is about around 30, and the average positivity rate is just over 2%, which is lower than any other point during the pandemic. Hospitalizations as well as deaths also remain low. And on Sunday, June 6th, there were 0 new cases reported. And these trends are very encouraging. Exactly just 1 year ago this week, the positivity rate was nearly 10%. The average daily new cases were close to 200. So as the COVID positivity rates and hospital rates and deaths continue to decline across the country, I want to emphasize that unvaccinated groups in particular remain at risk. And so results of a Washington Post study showed that nationwide cases, hospitalizations, and deaths are 73% higher for unvaccinated people. And this data is a reminder of the importance of vaccinations, as well as maintaining mask wearing and physical distancing for people who are not vaccinated. So if you have not been vaccinated, I urge you to do so. And there are many places across Milwaukee County where you can get the COVID-19 vaccine, including a few that we'll be talking about shortly. The data has clearly shown us time and time again that the vaccination is safe and it is effective. But to switch gears a little bit to talk about the Healthy Homes Initiative is another way that people can get their vaccination. And 2.5 weeks ago, we announced Healthy Homes, Milwaukee County's free at-home COVID-19 vaccination program, and with the goals of ensuring as many people, as many members of our community can get vaccinated as soon as possible. And this program was specifically designed for individuals who have difficulty leaving their home to have access to a COVID-19 vaccination, which is going to help to meet residents where they are and bring vaccines directly into their homes. And as we shared at that time, the program takes a hyper-targeted approach to proactively make phone calls to individuals who have difficulty leaving their homes. So because in many cases, these individuals have not been reached by previous programs, when we began our outreach, we didn't know what the demand would be. But what we did learn, thanks to the diligence of those working on the Healthy Homes effort, is that there is not only a great need to connect these individuals, but a great willingness to be vaccinated when individuals are able to overcome the barriers of having to leave their home. And since we launched the Healthy Homes, Milwaukee County's Office on Emergency Management, we've connected with about 57, we have done 57 in-home vaccinations to date, and we have 30 more scheduled this week. And we're working to schedule another 276 people in the future. And I want to say thank you, and we really appreciate their patience. But when you think about this, the demand has really forced us to create additional partnerships to ensure that we have vaccinators available to meet the needs of the Healthy Homes program. So this week, we began the process of partnering with Hyatt as well as Sage Pharmacy, which will more than double our capacity and eliminate barriers to vaccinations for even more people throughout Milwaukee County. Because together we can create healthier communities by making services accessible and by physically meeting residents where they are to connect them to the needed services like the life-saving COVID-19 vaccine. And just as a reminder, if you or someone you know is in need of an at-home vaccination or is interested in learning more, please visit healthymke.com/healthyhomes. Again, healthymke.com/healthyhomes. And with that, I'll hand it over to Mayor Barrett. Mayor Barrett.
Thank you very much, Mr. County Executive. It was a week ago today that the city of Milwaukee allowed its health order moving Milwaukee forward to expire. June 1st was the day that expired. And I think a lot of us here were wondering, okay, what exactly is going to happen now that that health order has expired? Well, I'm here today because I'm happy to report that this week, as the county executive indicated, our COVID-19 metrics continue to show improvement. So it makes me feel good that we made that decision. When we made that decision, I think it was the right time to start moving life back to normal. And I feel that way because we are seeing decreases in disease burden, and we are also seeing increases in our vaccination numbers. Although we want our vaccination numbers to continue to improve, and we know we have a ways to go there. So I'll touch on that a little bit later. I also want to just take a minute and talk a little bit about the federal funding that we're receiving. The city of Milwaukee will receive a total of $394 million in federal assistance to help recover from the pandemic, and public input will help determine how a significant portion of this money is spent. We have an online survey. The survey is available in 3 languages, in English, Spanish, and Hmong. And you can complete the survey at engagemke.com/ARP through the end of June. Now, we have begun making some decisions. In fact, I introduced the council with the support of the council president several weeks ago, funding for summer youth employment, because I feel that we as adults have a moral obligation to create hope and opportunity in the lives of young people in our community. And the best place for that to start is with a summer job. Every adult I've ever met can instantaneously tell me their first job. And I feel very, very strongly that we have to create opportunities for public positive engagement for our young people. So that file will be coming before the council. We're working on another file that deals with some other priority spending for the summertime, but we are asking respondents to help prioritize other spending options among various categories to help inform the city's use of funds over the next 2 years. We've gotten some guidance from the Treasury Department because the initial indication was that this money has to be spent by December 31st, 2024. That was the belief, but the Treasury guidance has essentially said that if the money is allocated or encumbered is how I would describe it by December 31st, 2024, it needs to be spent by the end of 2026. So that means that this $394 million can be spread over 6 years. But right now, what we are doing is we're actively looking to see how we can best use that money this summer to deal with some of the most pressing needs we have. So the money Milwaukee is receiving opens an unprecedented opportunity for our city. It's a chance to make investments that would be impossible without our funding, and it will be spent to improve lives, solve problems, and address racial equity issues. It is summertime, and that means baseball is here, and the Brewers have been playing very, very well. It was great to see them sweep that series over the weekend, and I'll be joining the Brewers in recognizing reopening day, and that's June 25th, with an official city proclamation. And if they keep winning like they've been winning, I think more and more people are going to be paying attention to that. We all know we missed the opportunity to have a real opening day at the start of the season because of the pandemic restrictions. So as the situation continues to improve, we'll try again. The Brewers have been a great partner, and they will be hosting 2 additional pop-up vaccination clinics at Helfair Field. That's the Little League Stadium right there on the ballpark grounds. And that will be done in partnership with the Milwaukee Health Department next week, Tuesday, June 15th, and Wednesday, June 16th, prior to the games against the Cincinnati Reds as part of Major League Baseball's Vaccinate at the Plate initiative. Those who receive a vaccination will receive 2 free tickets to that day's game. The clinic will run from 4:10 p.m. to 7 p.m. on Tuesday. And because Wednesday's a day game, they'll run from 10 a.m. to 1 p.m. on Wednesday. So if you haven't gotten the vaccination and you want to go to the ballpark, it's a great 1-2 punch. Get the free ticket and go watch the Brewers continue to win. Both Pfizer and Johnson & Johnson vaccine will be available. And those who choose to receive the Pfizer vaccine will be instructed to return for their second dose between 3 to 7 p.m. on Wednesday, July 7th. Another important location for us is the Washington Park Library, located at 2121 North Sherman Boulevard. That site continues to offer vaccinations to the public on Wednesdays and Fridays from noon to 4. And I say that's an important location because it is very, very close to some of the neighborhoods and census tracts in the city of Milwaukee that have the lowest vaccination rate. And so we wanted to make sure, and we are making sure, that we have readily accessible vaccinations very close to individuals who live in those census tracts and zip codes that have the lowest vaccination penetration. So we are bringing it to the people, literally, for people in that neighborhood to get the shot. MPS continues to be our partner, but as we all know, with the school year, the end of the school year quickly approaching, those sites will be no longer used, at least in the foreseeable future. The public can take advantage of these locations from 9 a.m. to 11 p.m. on the following days. Morris Middle School will offer vaccinations on Wednesday, June 9th. Roosevelt Middle School, the Arts, will offer vaccinations on Wednesday and Friday, June 11th. North Division, South Division, and Carmen School, South Campus, will offer vaccinations on Thursday, June 10th. And finally, Rogers Street Academy will offer vaccinations on Friday, June 11th. So again, this week, as we come to the end of the school year and these clinics will be concluding, please take note of that. There are several other pop-up vaccination clinics that will be available. On Wednesday, June 9th, the United Methodist Children's Services of Wisconsin, located at 3940 West Lisbon, again, close to those zip codes where we're seeing low penetration, will be offering vaccinations from noon to 4 p.m. And Ascension All Saints Family Health Center in North Milwaukee, located at 2400 West Villard Avenue, will offer them from 1 to 5 p.m. On Friday, June 11th, again, the Mexican Consulate will continue to be our incredibly good partner and offer weekly vaccine clinics from 3 to 5 p.m. at 1443 North Prospect Avenue. Finally, yesterday I announced the Mayor's Design Awards. Great projects all around Milwaukee that add to the character of our neighborhoods. And each year when I've done this, I've done it, except for last year and this year, with basically hundreds of people there to see it. Yesterday it was done remotely on North Avenue. But what we were able to do is identify those buildings and those structures that over the last year have added to the quality of life and the vitality of the city of Milwaukee. So you can follow them and see that at Milwaukee DCD on social media to see the featured projects all week long. And with that, I'm going to turn it over to Dr. Weston. Dr. Weston.
All right. Thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 20 new cases a day. That's the lowest number of daily cases since COVID first appeared in our county. And we're seeing about 1 death every 2 days. Trends continue to improve. Our positivity is at 1.7%, and we've had 43 patients currently hospitalized with COVID. Both of those are the lowest levels we've seen since we started tracking the data. This is really great progress for our community. There have been several global news developments with regard to the Delta variant of COVID-19, which is now beginning to affect us in the United States as well. So just as a reminder, the virus mutates a bit each time that it replicates and spreads. And while most of these mutations do not change the virus, or quite often weaken the virus, on occasion a mutation takes place that happens to allow the virus to evolve in a beneficial way, giving it some sort of advantage, such as easier transmissibility. And these variants are more likely to crop up when there are major outbreaks of the virus, such as what we saw in the UK previously that developed the B117 variant, which is now called the Alpha variant, or most recently, the outbreak in India has led to several variants, most notably the B16172 variant, or simplified the Delta variant. So again, Alpha variant was previously the UK variant, and Delta is this new India variant. And you may recall that the Alpha variant is about 50% more contagious than the original or conventional COVID that we had back in the fall. And because of this advantage, because of this increased transmissibility, that Alpha variant quickly became the dominant variant in the UK and more recently in the United States. It's now the most common virus type in the United States. It's the most common virus type in Wisconsin as well. Now that's old news. What is new is that the Delta variant, that which caused so much disease and death in India, has been found to be even more contagious. It appears to be about 40% more contagious than that Alpha variant. So this comes down to the fact that it's extremely contagious. Now, in addition, there's mounting evidence that the risk of severe disease may also be higher in those with this new Delta variant. So because of that contagiousness, the Delta variant has quickly become the dominant variant, not just in India, but also in the UK, overtaking that Alpha variant. And at the same time, the UK seems to be entering a third wave of disease, seen more than a doubling in daily cases in the last 10 days. And it's important to note the UK has nearly identical vaccination rates to what we have in the United States. So the troubling news in our country is that we're now at about 6% of cases in the United States from that Delta variant. And that proportion is rising. And based on the trends in the UK, there's no reason not to think that just as the Alpha variant did, the Delta variant will become dominant in our country as well. Now, the good news of all this is that the vaccines appear to still be very effective, even against this new Delta variant. However, there was a recent study that showed that it's key to get both doses of the 2-dose vaccines. Partial vaccination with just 1 dose of the 2 doses does not provide adequate protection against the Delta variant. So if you got Pfizer, for example, you have to get your 2nd dose. You can't just get that 1st dose. Now, much as it did in the UK, this new variant threatens to push up our case numbers and our hospitalizations among those who are not vaccinated. So with this more contagious and potentially more severe variant rising in the United States, now is the time to get vaccinated. And if you're unvaccinated and you've been lucky enough to not have gotten COVID yet, you are truly on borrowed time. The virus is not the same as it was last spring or in the fall. It's far, far more contagious and potentially more dangerous, more severe. So not only can you protect yourself by getting the vaccine, but you can also slow the spread of this new and more dangerous variant in our community. And how to get the vaccine, go to healthymke.com, talk to your doctor, or from talking to patients, honestly, just stop by your local Walgreens or drugstore. You can get the vaccine. It's quick, it's easy, and it's completely free. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson. Oh no, I'll hand it to, I believe, Mara Lord.
I think we want to go to the commissioner first, real quickly, if she's on.
Perfect.
Oh, I'm sorry, Commissioner Johnson.
We have a lot of people on here. No problem, Dr. Weston.
Thanks, Dr. Weston. I am here. So I'm excited to announce that we vaccinated over 500 people at our mobile clinics this last weekend. Our first drive-through clinic at Summerfest was a huge success. Almost 400 people received their shot and a free Summerfest ticket. Black Husky Brewing threw an entire street festival, complete with live music and food to bring vaccinations to River West. And Mexican Fiesta provided free tickets to their 2021 festival for those who were vaccinated at the Viva MKE Marketplace. The number of vaccinations we're administering at these clinics shows the success of these incentive opportunities. In addition to the Brewers vaccination clinics announced this morning, we have another exciting opportunity for Bucks fans. So this Thursday, the Milwaukee Health Department will be at the Deer District from 5:30 to 7:30 to vaccinate anyone who's in the plaza to cheer on the Bucks. Everyone who receives their vaccination at this event will be entered into a raffle to win 2 free tickets to the playoff game on Sunday, June 13th. The winner will be chosen randomly and notified with instructions to receive their tickets. We're grateful for our community and business partners who've so generously offered incentives and opportunities to vaccinate Milwaukeeans. Our team is ready to bring vaccine to events and organizations throughout the city, so please reach out to us at 414-286-6800 if you would like to host a clinic. The percentage of vaccinated individuals in the city of Milwaukee increases each week, which is encouraging, but we would like to see this increase even faster. Currently, 50.4% of adults have received at least their first dose, and 43.7% are fully vaccinated. I know there are people who are still reluctant to be vaccinated, and the Milwaukee Health Department is available as a resource to answer any questions you have about the safety and effectiveness of the vaccines. Our data is proof that vaccinations are working to bring the burden rate down in our city. Our most recent data shows our burden rate at 19.1 per 100,000 people, and our percent positivity is down to 1.9%. Our numbers continue to decrease week after week, but if we want to see this trend continue, we must also keep vaccinating. Vaccination is a community effort. Even if you've already received your shot, you can still help vaccinate others. Take time to reach out to the unvaccinated loved ones in your life. Share your experience, be a trusted resource, go with them to a clinic, and help keep your community safe. If you're nervous, reach out to healthcare providers, public health staff, community leaders, or friends and family to answer your questions. The vaccines are easily accessible, readily available, free, and many are even coming with added incentives. If you've been putting off your vaccinations, there is no better time than to do it than now. There will come a time when the vaccines aren't as easy to get, so please take the time now to do it. It is quick, we have an ample supply, and we can even bring vaccines into your home. If you'd like to schedule a home vaccination appointment, please call our hotline at 414-286-6800. Finally, the Northwest and Southside Health Centers still have walk-in vaccinations available without an appointment Monday through Friday. Beginning next Tuesday, June 15th, the hours will adjust slightly and our clinics will be open from 12 to 6 p.m. Updates on hours, upcoming mobile vaccination clinics, and information about vaccines can be found on our website at milwaukee.gov/COVIDvax. Thank you.
All right, let's turn things over to Mara Lord with the Medical College of Wisconsin and VICOM.
Hi, thank you so much. While I'm getting my slide deck ready to share here, I just want to do a shout out to Commissioner Johnson and Dr. Tamaro for all of the work that they've done to build these incentive-based clinics. And you'll see in the data that I'm about to share that those are really, really helpful and working. Sorry, I'm just having a moment here to share this screen. All right. So I wanted to share some vaccine intent data with you today and give you some national data and then with some local insights as well. So first of all, the national vaccine trend is favorable. As you can see, the look at starting in December 2020 and the changes over time. So now as of May 2021, and this data is as of just 2 weeks ago, actually more like 8 to 9 days ago. This information is showing that you've got about 62% of the individuals across the nation. This is adults, though. I just want to be clear. This is for 18 and older across the nation already having received their vaccine. So the trend is favorable. And what we're seeing locally, and you've already heard the numbers from a couple of different people, is that we're trending favorably too. We are lagging national data by about 10 percentage points overall. So taking a look at this, and this makes that point that Milwaukee area is pacing with most national trends, but we are lagging still in vaccine uptake with Black and Hispanic populations in particular. And so you can see here, Hispanic adults and Black adults, 57% already received 1 dose nationally, 56% of Black adults received 1 dose. Our rates in the Milwaukee area right now are still Hispanic adults are around 35 to 36%, Black adults are around 25 to 26%. So those are of concern, and I know that all of the efforts that are put forward and already have been discussed by the county executive, the mayor, commissioner, and Dr. Weston, obviously are very positive and trying to pull those efforts forward. But we certainly need to do more. So also, I wanted to just hit a little bit on this wait and see, because this has been language that we've used now for the past couple of months, that there are individuals who keep saying, I'm going to wait and see. And so we have a certain percentage. Actually, let me go back to this slide. You can see this light blue here, wait and see, and the trends across these different populations. So no population is monolithic in their attitudes. And I think that that's a common theme. So as we look at this, we can see that though about 37% of those who are already saying, I'm going to wait and see, or have been saying, they are actually thinking about getting that vaccine in the next 3 months. So this next 3 months is a really critical time. And reasons for that, I'll show you a couple of incentive pieces, but there's this anticipation that the FDA approval will be coming for vaccines that already are authorized. And that seems to be a big motivator for individuals saying, I've been waiting to see, and that would really tip things for me. But then you can see that about 34% of people are saying that they are, they're going to wait more than a year. They want to see what that more longer term effect is over this next year. But that's 34% of the wait and see individuals, not 34% of individuals overall. So again, you've heard a lot about incentives in this meeting, and I just want to put some numbers around it. So incentives that we're hearing that will influence that wait and see group, and keep in mind that the wait and see group, these are individuals who, they have not said definitely not. They are saying, I'm just not sure, or some of them are indifferent to the vaccine. So look at this, 44% are saying that, full FDA approval of the vaccine would influence me getting the vaccine. 21% of wait and see individuals are saying, if I could get time off from my employer, not only time off to get the vaccine, but to recover from it, that would help. And then take a look at these incentives. And this is Kaiser Family Foundation that tested these questions. About 15% of individuals are saying, if I receive $100 to get the vaccine, I'm in, I'll do it. Whereas about 10% are saying $20 to get the vaccine, and they would do it. But these other incentives, you can see 13% free ride to get the vaccine. We'd have a lot of efforts going on in this community around free rides to vaccine. 11% are saying free tickets to a sporting event or a concert. And again, I think the Brewers and the Bucks and the Summerfest events are absolutely, right on right now to do those things. I also put in here, Katie Lepak, who is the vaccine coordinator for the Ueoc, brought this up this morning, vaccines.gov/incentives. So that's a website to go to, and those are national incentives. I gave a couple here where we have access to in our community. There are many, many, many more incentives, but it's worth, if you're promoting vaccine and reasons to get it, this is definitely a place to just take a quick look at it and see what might be available. So I also wanted to touch on kids. So the data, again, from Kaiser is saying that 4 in 10 parents say their adolescent has already received at least the first dose of the vaccine or will do so soon. And so that's a good number to start with, but of course we want to keep pushing that up. This is really interesting to me. So 1 in 4 parents of children under age 12 say they'll get their child vaccinated as soon as it's available. So that's total, 1 in 4. Look at the difference here in those individuals who are unvaccinated parents versus those who are vaccinated parents saying, I will get my child vaccinated. So we know that, again, as we try and influence individuals to get the vaccine, continuing to work with those adults and get a sense of where they are and how to bring things directly to them is going to be really critical. So just speaking again on incentives briefly here, incentives and immediacy are this new course of action, which I think we've heard in spades during this call, but a couple of other just key quick points for you. So first of all, offering incentives with immediate or coveted value. So that immediate, here you get something for it, or there's a value of something that I wouldn't have access to otherwise is, showing to be, and this is national data showing to be helpful. But you know what? Let's not discount those small nudges. What we've been seeing is that text messaging where the text message says there's a vaccine waiting for you, or vaccine is available to you, it's it has your name on it. Those nudges have a really interesting psychological and emotional effect, and they are helping people say, oh yeah, that's for me, I'm going to take the action to get that. And then the other that we're finding is make it an experience. And again, all of these events that are happening around the community is absolutely spot on. Make it an experience. Offer to take a family member or a friend to get vaccinated, and find an event that you both enjoy. Go have a beer at Husky Brewing. Go to the Summerfest grounds and make it, an outing, and bring somebody with you. And then again, just a reminder to employers, offering that time away from work is really critical for those who are employed. And then just one moment on, I wanted to talk a bit about the campaigns that we've continued to place in the marketplace to really encourage vaccine uptake. So first of all, we've shared this with you, the Authentic Voices campaign, and we are really lifting this in spades now in the communities where we have the most need, in the highly vulnerable and low vaccine census tracts, as Mayor Barrett mentioned earlier. So the Authentic Voices campaign continues. It's actually elevated now and will be through the end of summer. But what we are now focusing on is asking people to share what's their why. Why did they choose to get vaccinated? And so you can see here's the Bucks have done a piece, the Brewers have done a piece. We're working with groups around the community as well to give their why online. These are just static shots, but these are actually videos. And then we're now starting to talk about getting back to who and what we love responsibly. And as Mayor Barrett mentioned earlier, I mean, as we continue to open up, it's so critical that we continue to send the message of responsibility and of respect and honoring people and meeting them where they are, because we know that this can be personalized and it can be politicized. I just want to bring up an example that I heard recently in the community that I thought was just a beautiful way to approach something. So a family, they're offering a graduation ceremony for their son. And they said, we're holding a graduation party outdoors, and it is, we have about 30 people coming. We want to celebrate with him, but we want to honor where people are. So they've created these stickers, and the sticker says, please wear your mask when speaking with me. And another sticker says, I'm good with no mask. And, so that there's a way to share where people are coming from without having to necessarily talk about vaccines. So I think people are just still coming up with really creative ideas, but getting back to who and what we love responsibly is a theme that we want to start carrying through. Here's another example: to get back to hugging friends responsibly, to get back with family responsibly. And we've been in all different communities. We are now producing pieces with the Hmong community. We've been working with Hispanic and Latinx community, Black community as well. And we have a number of different events that are coming up that are really helping to open up conversations with individuals. So that's it. Thank you for the opportunity, and happy to answer any questions.
All right, Mara, thank you. Lots of great information. Our first question comes to us from Sharon Bagenda, and Sharon is with CBS 58. And this one may be for the health commissioner. The question is, can we get an update on door-to-door vaccinations?
Sure. So there are a number of efforts occurring right now around the city where there are door-to-door efforts to educate people about the vaccine and its availability. And we are still internally right now really focused on these, our pop-ups and our community vaccination sites, and plan to move into that space as we move out of the community sites.
Sharon's next question, with these targeted vaccine efforts, are you seeing a preference in whether people want the one-shot regimen, J&J, versus the two-shot dose regimen?
That's a really good question. It's been really fascinating. It's really a mix. Initially, about a month ago or a month and a half ago, it was predominantly Pfizer, but at this point, it's a good mix of people asking for one or the other.
Commissioner, this next question may come to you, but it may also be for Dr. Weston. Ken Wainscott is asking, regarding the vaccination rates among the African-American community, do you anticipate reaching 50% vaccinated at any point? And the rate is nearly double in Minneapolis, for example, where the outreach efforts seem similar. Can you explain the different levels of success?
Sorry, I was muted. Yeah, so in Milwaukee County, I'm just looking at the data here. So our African-American population is about 26% vaccinated. So certainly lower than other populations. Now we know when we look at vulnerability of populations, a lot of times that is tied into our populations of color. And we've been targeting those vulnerable populations. Now it's hard to compare us to a place like Minneapolis, where the demographics are quite different. The infrastructure is quite different. The overall vaccination rate is quite different, but nonetheless, we continue to reach out to vulnerable communities. And as Commissioner Johnson outlined, and also as Mara Lord outlined, we see more and more openness to getting the vaccines among communities of color in particular. So I am optimistic that we'll continue to rise or increase our vaccination levels in communities of color.
Ben Wagner from WISN is asking, President Biden hopes to get 70% of all adults at least one dose by the 4th of July. Is this a realistic goal in Milwaukee? Maybe that question comes to the mayor.
Well, I think right now it'll take a lot of work to get there. We're not giving up, that's for sure. But we would like to see the numbers higher, and we're doing everything we can, as the health commissioner mentioned, to get this really this penetration into the neighborhood. So we have not taken our foot off the gas pedal in any fashion whatsoever. We're going to continue to try to meet that goal.
And Mayor, the follow-up question to that might come to you. It might also come to the commissioner. And that is, are there any numbers on how many people have been vaccinated through the incentive programs that are available?
A lot of these programs are private programs. I don't have those numbers. I don't know if you have those numbers, Commissioner.
I have some numbers. I can say that the events where we have incentives available have higher numbers than events that do not. So overwhelmingly. So at Summerfest this weekend, we did 396. At Mexican Fiesta, we did 39. And at Black Husky, we did 76. And I want to say at the Brewers, we did 134 for sure on, I think, the first day. And compare that to other events where the numbers are in the tens, teens, 20. So they definitely are successful.
The last question I have here in front of me is from mewisconsin.news. And the question is probably from Mara Lord. Mara, the question is, what is the communication strategy to share your campaign with our minority community?
Yeah, thank you very much. So we have a very diversified communication strategy, and we have purchased and earned and in-kind media that is wrapping around that Authentic Voices campaign. We have bus wraps coming up within the next couple of weeks as well. But as we move toward the Let's Get Back to Who and What We Love responsibly, that is largely going to be social media focused. And we know that we need to continue to reach younger and younger populations, and social media and digital media is absolutely where that needs to land anyway.
All right, thank you. That's the last question I have in front of me. I'll give the media another few moments. Any other questions that we can answer for you? Okay, sounds good. I guess that will wrap it up for our briefing today, June 8th. We'll look forward to seeing everybody again on Thursday. Thank you, everybody.
Thank you all.
Thanks, everyone.
Thank you.